We actually have been getting a lot of patients that are coming in asking about PRP, platelet rich plasma. They want it, they've heard about it in the news, a lot of athletes are getting it, so we've been getting a lot of questions about it. So here in kind of a simple form, this is PRP. It stands for platelet rich plasma, so it's just that. It's just part of your plasma that's really concentrated in platelets. We get it by, we draw out your blood, we spin it in a centrifuge, concentrate out all the platelets, and then inject it back in the body. So if you think about it, when let's say you accidentally cut your arm on something and you're bleeding and platelets stop the bleeding, well, there's actually so much more going on, because as the platelets clot and they stop the bleeding, they're going to change shape and release all kinds of growth factors. And it's actually those growth factors that are going to then help, heal the skin that's been injured until you no longer have that wound. Same thing when we inject it in a joint. They're going to clot, they're going to release a whole bunch of growth factors, and then over time help to heal your injury. Typically, when platelets activate, you've seen on our website the model that we kind of have where there's inflammation and then proliferation and then remodeling. That's what happens. It causes a whole lot of inflammation, so you might get some swelling, which you would notice, on a cut on your arm, or if we inject it in your joint. Then the cells are going to start to proliferate, make a whole bunch, and then start to kind of remodel in the appropriate form, as a tendon or as a ligament or as a labrum. Typically, in the office, if someone comes in, let's say for their shoulder, PRP would be good for something like a labral tear, or maybe even if they have a really nasty rotator cuff tear, we would do PRP. For a hip thing, typically it's a labral tear. Maybe if they have some kind of tendon degeneration, tendinopathy, we put some PRP in there. For a knee, a meniscal tear usually responds really well. And that's probably the most common. Of course, we can always do it for your neck or your low back or other chronic issues all over your body, but that's pretty typical about what we see. Sure. So actually, a patient that comes to mind we saw him last year, 29-year-old male, healthy, active, and he actually came to us because he had just a long history of shoulder problems. He had dislocated it as a teenager, I think when he was about 15, playing hockey, and then just repeatedly would keep dislocating it as he played hockey and other sports. And so when we saw him, 14 years later, when he was 29, if he did this is external rotation of your shoulder. I mean, you at home would be able to hear it clunk. It was so loud, and he just had a lot of pain. He couldn't really reach behind his back very well. When he lifted weights, he said his shoulder would kind of like come in and out, and he'd have to have someone help him to do weightlifting. So it was pretty bad. Like I said, young, healthy guy. Other than that, he wanted to be aggressive. He's been living with this for a long time, was told he needed surgery, and didn't want it. So we did PRP right off the bat, did really well. When I saw him for his second treatment, he actually, when he did this, you couldn't even hear anything. It was crazy, before this huge clunk, and now he was doing well. He said he could lay on it, fall asleep on it, and it wouldn't wake him up at night. We saw him 4 times, so over about a 4 to 5 month period, and he just kept improving. Typically with PRP, especially let's say, he had a labral tear in his shoulder, for the first kind of month, we want you to really kind of baby it. Don't do a lot of this kind of external rotation because you're going to put a lot of pressure on it. So just kind of keep it by your side. You can run, or do light exercises. And then as he was getting better, we kind of cleared him to do more and more weightlifting. We actually saw him maybe a couple months ago for a new injury, and his shoulder was great. He was doing really well after probably, maybe about a year since we saw him originally. We always do PRP with Prolotherapy here. We never do PRP without it. The reason why is, if you think about it, if you kind of go back to the shoulder, this example when he dislocated it, when he fell, I mean, you're taking your upper arm bone here, your humerus, and you're moving it like out of its place. So think of all the structures that are going to get injured as you do that. So if you do have this labral tear, sure, but you've probably, you've injured all the other ligaments, maybe some of the other tendons around the area. Same for, your hip or a meniscal tear in your knee. If you torque your knee enough, you're going to injure so many other structures. So why not treat them all comprehensively and give you the best chance of healing quickly? I actually have received PRP actually to my hip for a labral tear. Just some personal experience with it. Last summer, I was running, and all of a sudden, it just, you know, I kind of had some hip pain all summer, and I thought it was because I was out of shape and I hadn't been running a lot. And then I went out one day, I'm 2 miles from home, and I hear this like pop, and it immediately is just so painful. So then, you know, I walked 2 miles home because I'm 2 miles away, and just knew, like I knew that that's what happened. I had pain that was referring to my groin, my hip was clunking, and luckily I work in a prolotherapy office, so not long after that I did try just standard prolotherapy first, the dextrose solutions. I did 2 rounds of it, and it wasn't getting me better as quickly as I wanted. I wanted to run, it was summer, so then I opted for PRP, and I did 3 rounds, and I'm doing really well. So I'm back to running again. I ran yesterday. I'm not getting that pain. But you do have to kind of baby into it. You know, patients always wonder too, kind of with exercise and PRP, if it's different. No, if you get PRP, we want you to exercise. You know, we need that kind of stress and weight loading on all our tissues in order to get them to heal. You know, you can do all the PRP in the world to your hip, but if you're bedridden, you're not going to get better. You need that motion. So for me, I did cycling. I bought a bike, haven't ridden a bike in years, and just kind of did a lot of biking, did some elliptical, a lot of walking, and then slowly started, you know, jogging a little and rehabbed it that way, and I'm much better.